So I would like to share my experience during this unprecedented period of COVID-19, especially when it comes to patient care and management in hospitals. As you all know, we had to shut down most of the services during this period, especially the clinics, the elective inpatients. So the administration and the doctors came up with a very sustainable and practical idea to initiate telemedicine. Of course, this is something very new to the Ministry of Health, and it had a lot of challenges. One of them is to come up with a system that can reach the masses outside Muscat and within Muscat. And we had the support of the telecom companies, but they could not fulfill most of the things that we wanted, and therefore in the end we had to use the landline without the visual side. And the reason, of course, is audiovisual requires legislation to protect patients' rights and also doctors in case misdemeanors do occur. So what we then came up with a format of how one introduces oneself to the patients and the masses who require follow-up. And we would say our names, the institutes where we are working, and then we would ask that the person we are engaging with, her name, the hospital number, and at times the ID card, in order so that we don't divulge the medical confidentiality. It turned out to be very successful in terms of patients, very popular. In terms of doctors, we found that we were seeing more patients than the conventional way. Very satisfying, because we could reach out and give the results within 24 hours. It is tiring, it's taxing, but we could see sustainability. Of course, in the future, if such a platform is maintained with visual, it will be even more better, because quite recently a document from Deloitte put up a study talking about hospitals in 2040 and beyond. And definitely, without any doubt, telemedicine is a very powerful tool if it's used appropriately, very sustainable. A pound of your investment, you get £5 back, or reals. And not only that, it's that you can reach out the patients to their houses without requiring them to come to the hospital, where it is almost a torture of journey for the patient to go through, waiting for the doctors, waiting for the x-rays, waiting for the medications, and so forth. So Deloitte paper clearly envisages a well-known test that pregnant women do at home, buy a kit to see if they're pregnant or not. And can you imagine that I have kits being given to my patients that can do the test at home and then just electronically send the results? And I have, instead of clinics, I have a call center, like airport towers, where I look at all the data, process it, communicate with my patients, and engage in a sustainable, decisive manner, totally saving a lot of money and time and satisfaction on the part of the patient. Not only that, we can also learn from the banking system and the security system, using the chip in our ID in order to download our medical records, for which they can always be seen by the doctors or anywhere in the world by using the barcode. So this is something we should look at, instead of investing a lot of money on cement, building humongous hospitals, very difficult to sustain because of the overheads. But on the other side, engaging to such technology streamlining all the medical care and healthcare, preventive medicine, integrative medicine, imaging and diagnostics. I think COVID has brought its downfalls. However, we have learned a lot, and I hope we can use it for sustainability in healthcare, which is a very expensive item to engage. And I hope my information experience will be informative to the authorities who can take a decision decisively. So I hope we will be responsible, and each one of us, citizens, professionals, take their responsibility to keep up wearing masks, even though the COVID numbers have come down. But you don't know, you can have a surprise, and we have a rebound, what we are seeing now in the United Kingdom and other developed countries. So the message to all my dear citizens and fellow citizens to keep up the good health practice and wearing masks, less engagement and socialization, in order not to get a surprise.